Hello, welcome to another video. So in the last video we treated cholelithiasis, which is the formation of gallstones, and today we'll be looking at nephrolithiasis. So nephrolithiasis basically refers to the formation of stones, that is calculi, within the kidneys. So it is referred to as kidney stones, and these stones are basically composed of crystalline substances such as calcium oxalates, calcium phosphates, uric acid, struvite, or cysteine. So nephrolithiasis is a common cause of hematuria and renal colic, and it can lead to urinary obstruction, infections, and renal damage. So looking at the background of this nephrolithiasis, so nephrolithiasis affects about 1 in 10 people globally during their lifetime, and the condition is more prevalent in males compared to females, and it tends to recur in susceptible individuals. So risk factors include dehydration, dietary factors, like having a high purine diet, then metabolic abnormalities, and also genetic predispositions. So looking at the causes, so number one, like I said before, dehydration. So concentrated urine increases the formation of crystals. So this is why it's very important that we always try to stay hydrated. It's not good to go like long periods without having water, even if it's a glass of water. So hydration is very important. So one of the causes of kidney stones is dehydration, and then high dietary intake of oxalates, high dietary intake of sodium or animal protein, and then hypercalciuria, having excess calcium in the urine, hyperoxaluria, having excess oxalate in the urine, hyperuricosuria, which is having excess uric acid in the urine, then cystinuria, which is a genetic defect causing excess cysteine in urine, then infections. So infections from urease producing bacteria like proteus form struvite stones. So let's look at the symptoms. So when someone has this nephrolithiasis, there will be presence of blood in the urine, known as hematuria. There will be severe colicky flank pain radiating to the groin or the lower abdomen. There will be nausea and vomiting, which is a very general symptom for most conditions. Dysuria, which is painful urination. Then there will be presence of urgency, like urine frequency, like wanting to go to the toilet more frequently than usual, and fever and chills if infection is present, like infection with this proteus bacteria. So looking at the physiology of the kidneys filter blood and produce urine. So that is their job. That's basically what they do. And then the urine that they produce flows through the renal pelvis into the urethra, the bladder and urethra. So stones form when solutes in the urine become supersaturated and precipitate into crystals. Then these crystals, they may grow and obstruct parts of the urinary tract, causing the symptoms of pain and causing more potential worsening complications. So for the pathophysiology, the supersaturation of the urine with there's supersaturation of the urine with stone forming substances like calcium oxalate, uric acid. So crystallization occurs especially with low urine volume or inhibitors of crystallization being low, and then aggregation of crystals into stones, and then the stones can obstruct urine flow, causing hydronephrosis, infection, and eventually renal damage. So other conditions that could mirror the same symptoms as we see in nephrolithiasis, like other kidney conditions, like for example pyelonephritis, which is caused by an infection. So pyelonephritis, appendicitis, because when someone has appendicitis, they also have like this pain on their lower abdomen. So also abdominal aortic aneurysm, ectopic pregnancy too. So all these other conditions can mirror the same symptoms that we see in nephrolithiasis. Then how is this condition diagnosed? So a urinalysis is done, and it can show the presence of blood in urine, crystals, and pH abnormalities. And then an ultrasound, which is useful in case of pregnant women and children. Then kidney, urethra, and bladder x-ray may show presence of the stones. And then blood tests to check for serum calcium, serum uric acid, creatinine. Then there's stone analysis can be done if the stone is passed or if it is removed. Then there's something called non-contrast helical CT scan, which is the gold standard for diagnosis. So for the treatment of nephrolithiasis, looking at the acute symptom management, so number one, pain control. So what we give for the pain control, first line is diclofenac sodium 75 milligrams intramuscularly as start dose, followed by 50 milligrams orally every 8 hours as needed. Then if NSAIDs are contraindicated in this, if NSAIDs are contraindicated in the patient, that is in cases of when the patient has ulcer or renal failure. So opioids such as morphine sulfate or pentidine can be administered to help with this pain control. Then hydration, like I said, the first cause, the most important cause of nephrolithiasis is dehydration. So we have to encourage oral fluid intake unless the patient is vomiting, actively vomiting. And if oral route is not tolerated, then we can administer intravenous normal saline 0.9% sodium chloride at 100 to 125 milliliters per hour to maintain their urine output of at least 2 liters per day. So just try to make them to be hydrated at all times. And then to help with the nausea and vomiting, we can give antiemetics like metoclopramide or ondansetron as an alternative. Then we can also give some medications to facilitate the stone passage into the urine. So for example, we can prescribe tamsulosin 0.4 milligrams orally once daily for up to 6 weeks for patients with stones that are located in the distal urethra, measuring between 5 and 10 millimeters. Then so now looking at like the stone specific medical management. So for stones that are caused by specific, like for example stones that are caused by accumulation of calcium oxalate, then there's uric acid. So there are different management for the different stones that are formed. So for example, calcium oxalate stones, so we can recommend a diet low in oxalates. So we can tell the patient avoid spinach, nuts, chocolates, tea. Then we can prescribe thiazide diuretics such as hydrochlorothiazide once or twice daily to reduce the urinary calcium excretion. Then we can also consider potassium citrate supplementation to raise the urinary citrate levels and to alkalinize the urine. Then for uric acid stones, for stones that are caused by uric acid, so how we can manage this specific kind of stone formation. So promote like the alkalinization of the urine using potassium citrate 10 to 20 milli equivalents. Give it orally 2 to 3 times daily to maintain the urine pH above 6.5. Then prescribe allopurinol 100 to 300 milligrams daily if the serum uric acid is elevated or uric acid stones are like reoccurrent. Then we also encourage low purine diets like reduced red meat or organ meat and seafood. So most of the time, like I said, diet can affect is one of the causes of these kidney stones. So when we are looking at the management, we have to try to, even with the drugs that are given, even with the medication that is given, we have to try to change our diets, like try to reduce some certain things that we're eating to that are causing these stones. So in cases of when we have oxalate stones, we have to try to we have to do a diet low in oxalates, like avoiding spinach. Then with uric acid, trying to avoid things that have a lot of purines, so having a low purine diet, like reducing red meat, organ meat, all those things. Then for struvite stones, we have to require for struvite stones we require antibiotics targeting urease producing bacteria like Proteus or Klebsiella, because this particular bacteria, they are the ones that specifically cause these stones. So we have to use antibiotics in this case. So we start empirical antibiotics and then adjust the dosage based on the urine culture and the sensitivity. Then adjust the dosage and adjust the antibiotics we are giving. Like, for example, if you are giving empirical antibiotics, it's like giving antibiotics without knowing which of the antibiotics that the bacteria will be susceptible to. So you're just, most of the time empirical antibiotics are like broad spectrum antibiotics. So when you get the urine culture, you get to see like the antibiotics that the organism is sensitive to, so you adjust it. Instead of giving that particular one you were given before the urine culture, you can now be able to adjust it and give the ones that can be of better help in the situation. Then also looking at struvite stones, surgical removal is often necessary as these stones are large and they are branching. So in the cases of formation of stones from struvite, surgical removal is often necessary because the stones are large. Then for stones that are caused by cystine, so in this case we advise patients to drink large volumes of water, targeting more than 3 liters of urine output per day, and then restrict dietary sodium intake to reduce the cystine excretion, and also using thiol binding agents like thiopronin 250 milligrams taken orally 3 times daily, or penicillamine if the other conservative measures fail. Then some interventional procedures like some surgeries that can be done in cases of when a patient has nephrolithiasis. So there's one known as extracorporeal shock wave lithotripsy. lithotripsy, yes. So it's a non-invasive option for renal and proximal urethral stones that are measuring less than 20 millimeters, and fragmented stones are passed naturally. Then there's also another procedure known as uteroscopy with laser lithotripsy. So it's suitable for urethral stones, especially those not amendable with the former the extracorporeal, the other thing I said. So it's suitable for stones that are not amendable using that procedure, and it involves insertion of a scope through the urethra and bladder into the ureter. Then we also have another interventional procedure known as percutaneous nephrolithotomy. So this one is indicated for large, complex, or staghorn renal stones, and it involves direct access through the skin into the kidney for the stone removal. Then we have lastly we have open or laparoscopic stone surgery. So this one is reserved for rare cases when other interventions fail, or other interventions are contraindicated in the patient. That's when we use this laparoscopic stone surgery. Then in special populations like pregnant women, children, how we manage nephrolithiasis. So in pregnancy, we use only ultrasound for diagnosis, and the conservative management preferred in a pregnant woman is hydration and analgesics safe for the pregnancy, for example acetaminophen. Then surgical options like urethral stenting or uteroscopy are considered only when complications arise or conservative treatment fails. So we always try the conservative treatment first before we look at surgical options for in cases of pregnancy. Then when it comes to children, we have to always evaluate for underlying metabolic disorders, and then give them fluid and dietary advice based on age and weight. Then we can use potassium citrate or other agents as needed. So how do we prevent ourselves from getting these kidney stones? It's very easy. We have to advise patients to drink at least just stay dehydrated, like at least take 2.5 to 3 liters of water daily, ensuring that you have a clear to pale yellow urine, and then limiting our salt intake, animal protein, sugar sweetened beverages, and oxalate rich foods. Then also maintaining adequate but not excessive calcium intake, like 800 to 1200 milligrams daily. And then in recurrent cases, we have to consider long-term preventive pharmacotherapy based on the stone composition and the metabolic evaluation. So for the prognosis of this condition, the prognosis is excellent with prompt and appropriate treatment. Most stones pass spontaneously with conservative management if they are less than 5 millimeters. So recurrence is common with kidney stones. Approximately 50% of patients develop another stone within 5 to 10 years, and long-term complications such as chronic kidney disease or obstructive uropathy, they are rare if treated promptly and preventive strategies are followed. So complications are usually rare if we treat this condition very well. So we coming to the conclusion of this topic. So this topic is very important. It shows how important it is for us to always try to stay hydrated, always try to drink enough water daily, because most of our problems come from not taking enough water, and also comes from our diet too. So we have to watch what we eat, and we have to watch what we drink too. So that is it for this particular topic. See you in the next video. Bye.